welcome everyone to our option period 2021. We have our health, dental, vision, and life vendors to speak to us today. If you have any questions, you'll have the opportunity to ask each vendor, and you can also ask questions throughout the chat and we'll get to those. We will begin our option period enrollment on October 1st and it'll run through the end of the month to October 31st. So without any further ado, Lori Whitten will get us started. Thank you.
Thanks, Rebecca. Had to make sure I have my mic on. Thank you all for joining us this afternoon. As Rebecca said, my name is Lori Whitten. I am a group management specialist with the Employees Group Insurance Division. And for the past several years, you've seen me standing behind our little Health Choice booth there at the benefit fair. So I actually saw a few familiar names as you were sitting in a waiting room. So I wish we were there to see you in person, but trying to keep everyone safe this year. So with that, we will go ahead and get started. But welcome to Option Period 2021. Today we're just going to go over a few different things before we hear from our other plan representatives. Just a little reminder about what is option period, the different materials that are available to you. We have representatives with us from the health plans, dental plans, and vision plans. And then after they get done with their presentations, I'm going to show you a very easy way to find all of this information that you've heard about today. So option period is the time of year where you as a current employee can make changes to your current benefits. You can add plans, drop plans, hour drop dependents, all of that without there being any type of qualifying event, which means that we're not going to ask you a whole lot of questions about why you're making the changes. Just a couple of reminders. If you do cover one eligible dependent, you must cover all other eligible dependents on that same benefit unless they have a proof of that coverage elsewhere. Your dependents are defined as a legal spouse or children up to the age of 26. And those children can be your biological or adopted children. They can be children that you have guardianship over. They can be married, unmarried, in school, out of school. It doesn't matter as long as they are under the age of 26. The different materials that you have available to you are your benefit option guide that can be found on the EBD website. I have an option period form on here, but that does not apply to you since you are state employees, but we will go over the confirmation statement. So the benefit option guide, this is where you can find information on all of the plans that are available to you for 2021. You have the premium information. You have the comparison charts telling you how one plan pays on a certain benefit as opposed to another plan. But in the very back of that booklet, you have a contact information page that shows you a website and a customer service number for each plan that is available to you. So if you hear about a plan that you are interested in today and you need some additional information, you can always visit that website or call that customer service number to get the information that you need. So we're going to skip over this form. But if you do make any changes during option period, our office at EGID will send you out a confirmation statement. This confirmation statement will show any coverage changes that you made during option period. So it will show a benefit elections period that begins 1/1 of 2021. It will list yourself and any dependents that are covered on that benefit. But at the very bottom, it's going to show a total premium amount. Now, that total premium amount does not include any benefit allowance that you receive from the state. So keep that in mind when you see that total amount there so everyone doesn't freak out on us. So chances are very good that that amount that's shown there is going to, what you actually owe is going to be a lot different than what is shown on that statement. Now, if anything on that confirmation statement is wrong, say you enrolled in ABC plan, but it's showing an XYZ plan, take that to Rebecca just as soon as possible, and that way you all can get that corrected before the beginning of the year. Are there any questions at this point? I do have one of my coworkers online with us. Her name is Leslie Self, and she's managing our chat feature within Zoom. So for those of you that may not be familiar with Zoom, if you look at the very bottom of your screen where the menu bar is, there's going to be an icon that says chat. If you click on that chat function, it will give you the opportunity to type in any messages or questions that you may have throughout the meeting. Leslie will be there to answer those in a very timely manner. Also, as we go throughout the meeting, at the very top of your screen, in the kind of the right-hand corner, you have the option to how you want to view the meeting. Do you want to see everyone's faces? Do you only want to see the person that is presenting? So you have the different options there. So you can see the whole gallery view, or you can just see a presenter view if you would like. But I do encourage you to take advantage of that chat function. If you have questions for the vendors as they go throughout their presentation as well, please ask questions. They are here to answer anything that you may have. If you want, you can unmute yourself and ask questions that way as well. So do not hesitate to ask, please. Leslie, do we have anything at this point?
No questions at this time. I'll be putting our website and our phone number to member services in the chat here in just a minute.
Okay, thank you. So this brings us to our plan presentations. We are very fortunate to have all of our health plans back for 2021 that we've had in this current year. That includes the Blue Links HMO plan, Community Care, Global Health HMO, Health Choice, and then a TRICARE supplement that's offered through Selman & Company. We have representatives with us from all of the plans except for Community Care and the TRICARE supplement with us this afternoon. But before we get to their presentations, just a couple of reminders. All of the health plans, regardless if you're looking at HMO, PPO, all include the same, what I call core benefits. And they all offer preventive services. And those preventive services are outlined by the Affordable Care Act, so they're the same for each company. They all have prescription drug benefits. Now, the co-pays or formularies may be different, but they all offer a prescription benefit. Same for pre-existing conditions. None of the plans offered through the Employees Group Insurance Division have pre-existing conditions attached to them. Out-of-pocket maximums. Out-of-pocket maximum is the amount that you, as a member, that's the most that you would pay throughout the calendar year for your medical services. And then the coordination of benefits. And the coordination of benefits is where you may have your insurance with Career Tech, but maybe you have insurance for your spouse as well as a secondary coverage. As long as both of those plans know about each other, they can coordinate benefits to say, oh, we pay primary and this one's paying secondary. So that when the claims come in, they know who needs to pay what. So with that information, I am going to turn it over to Christian Gray. He is our representative with Blue Links HMO.
And hi, Lori. How are you this afternoon?
Hello, I'm good. How are you?
Well, I'm great. And good afternoon, everyone. My name is Christian Gray, as Lori mentioned. I'm with Blue Cross Blue Shield of Oklahoma. And if you don't know, Blue Cross Blue Shield has offered insurance to Oklahomans for nearly 80 years. And we are really pleased to be continuing to offer insurance to you. Can you go to the next screen, please? At Blue Cross Blue Shield, we try to do our best to save you money. We try to do our best to give you access to quality and affordable healthcare providers. And if you have any questions after you choose Blue Cross Blue Shield, we want to give you the answers that you need. Couple of ways we save money. We do not have a deductible, as Lori mentioned. That means the moment your plan becomes active, you are immediately shifted to where we start helping pay for those medical services. We also have no copay for your primary care physicians. That means also that when you go to your doctor, whether it's January 1 or whether it's July 15th, we will cover that cost of you visiting your primary care doctor. And if you utilize the benefit that Lori spoke of, which is the benefit options guide, you'll notice that we are the lowest cost HMO option available to you, offered to you. We are the largest HMO network in the state of Oklahoma. We do not require referrals for you to see a specialist from a primary care physician, and we give you options to get help outside of normal doctor's hours. We do that through our 24/7 nurse line, and we also have virtual visits that is powered by our vendor, MD Live. It is for no copay as well, but it allows you to have a virtual visit either by phone or video with a board-certified doctor or therapist for no copay as well. Next screen, please. I mentioned a couple of the ways that, a couple of the $0 costs that are available if you choose BlueLinx, but I do want to highlight one on this screen as well. If you look toward the middle of the screen, you will see preferred generic drugs as a $0 copay. We really like to highlight that because a lot of medications that we normally take, whether it's for diabetes or whether it's for thyroid conditions or blood pressures, a lot of those can be found generically. And we do have an extensive list of preferred generic drugs that are $0 copay. So if you're one of those people that are looking to save money maybe on your prescription drugs, you may want to look at our plan to see if those drugs are covered for you as well. Next, please. This slide here really speaks toward our network, but also ways that you can help save yourself money by utilizing our plan. Like I told you, we do have remote options available. We have primary care doctors available as well. And we also have urgent, emergent services as well. However, when you utilize those services, know the cost associated with them. So whether it's a virtual visit or a primary care doctor, you'll notice that there is a $0 copay. Once you move to the urgent care, that's a $25 copay. And then if you have more urgent needs, then it would be a $300 copay or more if you're using it the freestanding emergency room. We do also have nationwide coverage for urgent or emergent care. So don't think that with an HMO, you don't have the ability to travel and get care. If you travel, just know that our coverage will only cover for a urgent or emergent situation. Next slide, please. And this slide here just kind of speaks more toward the previous slide, but gives a little more detail. You don't have to memorize this. It is available on our website, and I know Lori will tell you how you can access our website from an easier point. But just knowing where you go can save you money. Next slide, please. This kind of wraps up my portion of the of presenting to you about BlueLinx HMO. However, if you need to find a doctor or check prescription drug information, or if you're currently already a member and haven't done so already, please visit dcbsok.com/state. That website there will give you access to this presentation as well as finding a doctor and all of those things. And don't forget, you can always contact us 24/7 at 85609-5684. And with that, Lori, I'll turn it back to you.
Thank you, Christian. And up next, we will have Marty. He is with Global Health.
Hello, Lori. Hello, everybody. Again, I am Marty Conway, and I am with Global Health. Global Health has been serving the state of Oklahoma employees and educators for the last 17 years. We're very proud of our track record taking care of people in Oklahoma. And again, we are offered in all 77 counties in Oklahoma. Next, please. You'll see here that our benefits for 2021 are not changing. They'll be identical to what we've offered in 2020. I do, however, want to highlight just a couple of them. The $25 urgent care copay, I just want to make sure you're aware that that is good nationwide and in all U.S. territories. So if you're out of state on vacation or for any reason and you have a health care need, that cost is going to be the same for urgent care no matter where you're at. And of course, we all cover emergency situations. On the $500 maternity delivery copay, that does include prenatal and postnatal. So that's a very good benefit for anyone who's wanting to start a family or expand their current family. And then on the $10 tier 1 generics, I just want to point out that if you are on one of the medications that you take continuously, you can order a 3-month supply on mail order and get that for 2 copays. And the Global Fit Gym membership discount for anyone that likes to go to the gym and work out, that's a very good benefit. It'll save you money. And the last thing I'm going to talk about here is the referrals. Global Health will still be requiring referrals for 2021. The problem we run into is people are still being sent out of network, or they're going to a higher cost facility. So our staff looks at those, and if you, for instance, are sent to a higher cost facility, we will actually call you and ask you if you would like to save money and go to a preferred facility, which is basically your standalone ambulatory type facilities. Next, please. Here's our cost, and we just got it up front and center so you can see what it will cost you should you choose our Global Health plan. Next, please. On this screen, we've got several people that have written in and given testimonials and talked about how good a job Global Health did taking care of them during a time of need, especially if you have a real critical ongoing situation. Our Global Health case managers are going to contact you. They're going to help walk you through those situations. They can be so trying anyway without having to worry about how to cross your T's and dot your I's and take care of everything. We're going to help you in any way we can. Next. Here's our provider network. We've got over 4,600 providers in Oklahoma. We've highlighted the Oklahoma City and Tulsa area. In Oklahoma City, we've got Integris, Mercy, St. Anthony's, several others, but those 3, as most of you are aware, have hospitals in different parts of the state. So we've got plenty of network for you to choose from and take care of your medical needs. I'll point out in Tulsa we do have Hillcrest and several other great facilities, but primarily Oklahoma City is what I'm talking about. Next. Here's all of our contact information. I noticed that a few people do not have a screen to look at, or they cannot see what we're showing. So I'm going to say out loud, our phone number is 844-299-6999. And our website is globalhealth.com/mystateplan. The other thing I want to mention briefly is going into 2021, Global Health will still be offering the lowest premium in the state for Oklahoma retirees. So please, if you're thinking about retirement, make sure you stop and compare the options that you have. You've got several great options. And last, I want to give you my personal contact information. I always ask people to contact our customer care first, but if you run into problems, you can call me. My phone number is 334-2846. And my email is martin.conway@globalhealth.com. Thank you, Lori. I'll send it back to you now.
Thank you so much, Marty. I appreciate you joining us this afternoon.
Yes, ma'am.
Up next, I'm going to kind of switch roles just a little bit and talk to you a little bit about our health choice plans that are available to you. We have all of our same plans back for 2021, and we are happy to say that none of those plans have had any kind of benefit changes or premium increases for 2021. So a few things that are unique about Health Choice include the fact that we are the only PPO plan option, which means that you can see both in-network and out-of-network providers. You can also refer to a specialist without a referral. Now, those specialist visits do have a $50 copay, so keep that in mind, depending on which plan that you're enrolled in. And we have thousands of providers throughout the state. So hopefully it makes it easy for you to find someone that is in the network. The Health Choice High plan is our most popular plan for all of our currently enrolled members. And this is the plan that has the lowest deductible of any of the plans that Health Choice offers. Once that deductible's been met, then the claims are paid at an 80-20 split if you stay within the network. And it has an office visit copay for a primary care type doctor of $30 or that $50 for that specialist. The Health Choice Basic plan was designed for those people that spent years on the high plan, but maybe you never meet your deductible. This plan was designed just for you. Basically, each person that is enrolled in the Health Choice Basic plan receives the first $500 benefit. So each person will receive $500 to apply towards their medical care before you even have to meet a deductible. If you do get past that first $500 is when your deductible on this plan would start. It's a $1,000 deductible, and then it's a 50-50 split on those claims. But keep in mind, on that basic plan, this is the one plan that we offer that does not have an office visit copay, regardless if you see a primary care or a specialist. But you need to make sure that you know that, because the doctors always try to charge you a copay when you walk in the door. The high plan and the basic plans both have what we call an alternative plan, which basically means that if you or someone in your family uses tobacco products and you do not complete that tobacco-free attestation, then you're moved to one of these alternative plans, and the deductible on those plans is $250 higher. Premium is the same, deductible is just a little bit higher.
Lori?
Now, the Health Choice High Deductible Plan is the lowest cost option of all of the Health Choice plans, but it does have a higher deductible. It is designed to work with a health savings account, and if you're willing to fund that health savings account, then this plan could work really well for you. Basically, due to the low premium, you can take your premium savings from the amount that you receive from your benefit allowance, put it in that health savings account to help fund that account for your medical needs. Now, this plan does have what we call a combined deductible, which means that both your medical cost and your pharmacy costs both go towards that deductible amount. Once that deductible amount has been met, it works very similar to that high option plan, where the 80-20 split and the same office visit copays. But keep in mind, if you do have a family enrolled in this plan, you do have to meet the entire family deductible before Health Choice will pay on anyone that's covered on this plan. All of the health choice plans do include pharmacy benefits once you have met the appropriate deductible for that plan, and then you just have simple co-pays for the rest of that calendar year. That tobacco-free attestation that I mentioned, if you or any of your dependents do not currently use tobacco products and have not used tobacco products for at least the last 90 days, we ask you to complete this tobacco-free attestation every year. This year you have until November 13th to get that completed. And this basically will keep you on either the high or the basic plan with the lower deductible amount. Now, if you are going to be a new member to a health choice plan for 2021, or maybe you are a brand new employee with Career Tech since option period of last year, then you do not have to complete the attestation this year. We give you a full year of enrollment before asking you to complete that. But while you are completing that tobacco-free attestation, we have included a way for you to verify if you do have other insurance coverage. So try to capture that information for that coordination of benefits. So the attestation and the verification of other insurance coverage can be found on the Health Choice website at healthchoiceok.com. A few value-added programs that we have built into all of the Health Choice plans include our Select program. And the Select program has been around about 4 years now. And this is where you or your covered dependents can go and receive certain services or obtain certain medical procedures at either 100% covered or at a very low cost, depending on which plan that you're on. The whole key to this program is the facility. So if you need to have a certain service done, make sure that the facility that you're going to is part of the Select program. There are around 300 different procedures that are covered as part of this program, including knee replacement, rotator cuff. There's different eye surgeries, tubes and tonsils if you have a young child at home, but also different services like an MRI and a CAT scan. As long as you go to a facility that is part of this program, if you're on the high or the basic plans, then you do not even have to meet your deductible up front before it's covered at 100%. And if you're on that high deductible health plan, per federal rules, you do have to meet that deductible up front before Health Choice can pay that at 100%. But by going to that Select facility, you're going to get a much deeper discounted rate than you would if you went elsewhere for that same procedure. Again, all of those procedures and services can be found on our website at healthchoiceok.com. We added in 2020 a telemedicine feature through SwiftMD. I believe when I was at Career Tech last year, we had not yet finalized the agreement with SwiftMD, but SwiftMD is our provider for telemedicine. And this is a feature that's available again to all Health Choice members and dependents 24 hours a day, 365 days a year. You can either go to their website or give them a call, and a doctor will give you a call back, usually within 15-20 minutes, diagnose you over the phone or through video chat, whichever you prefer. And they can even call in prescriptions to your local pharmacy if needed. So I encourage you to take advantage of that feature as well. And the one fairly new benefit that I'm very excited about is our Health Choice Benefits app. You all know we have stood around forever and heard everybody else say, oh, we have a phone app. Well, guess what? Health Choice has a phone app now too. And this app has everything that you're going to need in one easy place. You can download the Benefits app from your app store, either for iPhones or Androids. And it has basically everything that I've already talked about in one easy place. You have access to the Select program. You have access to that Swift MD telemedicine feature, and it's all right there on your phone. If you look, kind of see on this screen, it says you can talk with a doctor. That's going to be your Swift MD. You can check your benefits, and it will show you how much of your deductible you've met so far this year. You can find a provider, access 0 medical procedures, but probably the two best things on this whole app, at the very bottom, it says digital ID card. So for Health Choice members, you have an access to your ID card and your pharmacy card right there on your phone. And so if you didn't have it in your wallet, you've got it right there on your phone. And probably the best part is it says live access to a care guide. We have a team of care guides that are designated for our Health Choice members. They can help you find a Select facility if you need to have a procedure done. They can help you find a network provider. They can even set those appointments for you. So if you have Health Choice now, take a couple of minutes, download this benefits app, and you will love it, I promise. But that is my conclusion for our Health Choice plans for 2021. Thank you for making Health Choice your choice. And if you need anything throughout the calendar year, please let us know. At this point, kind of switching gears again, I'm going to ask Leslie if we have any questions that we need to address.
No specific question at this time. We did have a concern to get a little bit more information on Health Choice High, but I think we'll attend that in the chat.
Okay, thank you so much, Leslie.
You're welcome.
Okay, we are going to keep on going with our presentations, and we're going to switch gears to dental. New for 2021, we have 10 different dental plans available for you to pick from. So we have added 3 new dental plans for 2021. So hopefully there's a plan in there that will meet the needs for you and your family. Our plans for 2021 include Blue Care Dental, Cigna Dental, Delta Dental, MetLife, Health Choice, and Sun Life. Now, again, all of the dental plans, regardless of which one that you are looking at, include what we call the same core benefits. So they all include a benefit for preventive care, basic and major care, and they all offer some type of orthodontic benefit. So again, at this point, I'm going to turn it back to Christian with Blue Cross again.
Lori, it's been so long since I've seen you. So
I know. How have you been?
Again, I'm back to talk to you about our Blue Cross Blue Shield Blue Care Dental Plan, and we are really excited to be offering a Blue Care Dental Plan to you. Many of you know about Blue Cross Blue Shield, the insurance company, the health insurance company, but few know that we've been offering dental for years now. And so we are glad to be an option for you this year as well. Next, please. As Lori said, we're bringing to you 2 different plans. We're going to bring a high plan and a low plan. Those different plans are all geared towards saving money, making sure you have access to the care that you need, and then we will take care of you after you if you do elect to use Blue Cross Blue Shield. Next, please. As Lori mentioned, we do cover all 4 major dental services, preventive, as well as basic, major, and orthodontic. Our preventive on both plans are going to be at 0 cost to you, and that's going to be your cleanings, your routine oral exams, your full mouth and bite wing x-rays, sealants, things like that. The main difference between these 2 plans are going to be your deductible and your annual maximum out of pocket. So that's where you really want to pay attention if you're choosing Blue Cross Blue Shield's Blue Care Dental. The high plan has a $25 individual deductible. The low plan has a $50 individual deductible. And then, respectively, the high plan has a $2,500 annual maximum, and the low plan has a $1,500 annual maximum. Next, please. On this slide here, it gives you what this slide depicts what you will pay out of pocket as a Blue Care Dental member. So for basic, this is how you want to read this slide. The 15% in-network, that means if you utilize an in-network Blue Care dentist, you will only pay 15% of a basic care service. So if you needed a cleaning outside of your normal preventive cleaning, we would pay 85% of it. You would pay 15% if it's in-network. Out of network, we do have in-network and out-of-network benefits. We would pay 30%. You would pay 30%, and we would pay 70%. I will say this: throughout our dental network, we have did a masterful job of making sure we can save you money at the dentist's office. That means that the normal cost of a procedure, we may be able to save you 20 to 40% less if you choose a Blue Care dentist, a Blue Care in-network dentist. Next, please. Again, here's the same contact information, so you don't have to remember the previous screen. We merged everything together at bcbsok.com/state, and then the same telephone number of 855-609-5684. From here, you can find both the dentist and a medical provider, as well as any other information that you need on Blue Cross Blue Shield. I really do appreciate your time, and we'll be back to you.
Thank you, Christian. Up next, we have Megan, and she is with Cigna Dental.
Good afternoon, everybody. I am Megan Wilson, and I am with Cigna Dental. We're so happy to be back to be able to provide affordable, quality dental care for the state of Oklahoma. And then we're very excited to be sharing a new plan option with you all during this year's option period, the prepaid high plan. Next. So with the prepaid dental plans, you can always count on your coverage to be simple to understand, predictable when planning for dental care for you and your family, and affordable out-of-pocket costs when you go to the dentist. So the prepaid high and low dental plans do utilize the Cigna Dental Care DHMO, or Dental Health Maintenance Organization network, which allows you to maximize your savings in 4 main ways. So that's going to be through affordable premiums. There's no waiting periods or deductibles, so the plan is always helping you pay. There are no annual dollar maximums, and your out-of-pocket costs at the dentist is going to be listed in your patient charge schedule, regardless of which in-network dentist you see. So it makes it a lot easier to budget for those dental expenses throughout the year. As a reminder, you must see an in-network dentist for your care to be covered. If you need help finding a dentist, you can always call Cigna or visit www.cigna.com. Next. So everything you see here is going to be included on both of the prepaid dental plans, including preventive care, such as cleanings and exams, second opinion, restorative care, such as fillings, and then those advanced procedures like orthodontia, which is offered to both children and adults, and then also implants. Next. So a really important note for this year is that the prepaid plan is going to be changing its name to the prepaid low plan. So during this year's option period, you must actively enroll into the prepaid low plan or choose another dental plan for the 2021 plan year. If you do not actively enroll, your dental coverage could end on December 31st of this year, 2020. So within the last week or two, if you are currently a Cigna prepaid dental customer, you should have received a letter in the mail kind of sharing some of these important details and plan information. Additionally, we are super excited to be sharing the new prepaid high plan this year. So here's a side-by-side comparison of the 2 plans, the prepaid low plan and the prepaid high plan, and also some of the examples of the copays for the different dental services that you can get. As a reminder, the copays will remain the same for the covered dental services as long as you get in-network Cigna dentists. So both the prepaid low plan and high plans do not have an annual deductible, nor a lifetime maximum, nor a calendar year maximum. So That really helps you because you can get as much work as you need to, and the plan is always helping you pay. Additionally, preventive care is going to be 100% covered on both plans, and then with the prepaid low plan and high plan, there is going to be coverage for orthodontia for both children and adults, and there's also coverage for implants. Next. And so when you're a Cigna Dental customer, you can have access to some other really great programs, such as the Oral Health Integration Program. So the Oral Health Integration Program is available to all Cigna Dental customers, regardless of their medical carrier. Customers must have one of the specific medical conditions to qualify for reimbursement for certain dental services, such as periodontal treatment. So if you know that you get periodontal treatment, this might be a program that could work very well for you. So customers do have to have one of the eligible medical conditions, including heart disease, stroke, diabetes, women who are pregnant, kidney disease, organ transplant recipients, and or head and neck cancer are eligible to participate. Next. So Cigna is here for you 24/7, 365. You're always going to be able to call us and get a hold of a live customer advocate. If you have questions about your Cigna Dental benefit options at 2 p.m. or 2 a.m., you can reach out to us, or if you need help finding an in-network dentist, please call 1-800-CIGNA24 or 1-800-244-6224. Additionally, after open enrollment, make sure you check out the My Cigna app, where you can access your ID cards, change your dental office, review your claims, and much, much more. Thank you for your time, and if you have any other questions, please feel free to use the chat feature. Thank you.
Thank you, Megan. One quick thing I would like to mention on the Cigna Dental, Megan mentioned that the Cigna Dental Low option, if you're currently in Cigna, it would not automatically renew. As state employees, so if you are currently in Cigna and you do not make a plan election during the option period, you will be defaulted to the Health Choice Dental plan. So just FYI for you there. Next, we are going to have a presentation from Eric with Delta Dental.
All right, good afternoon, everyone. My name is Eric Payne of Beardonk, and on behalf of Delta Dental, we are excited to be back once again and have the opportunity to provide you with dental benefits for 2021. Next slide, please. At Delta Dental of Oklahoma, we pride ourselves on giving you superior customer service, quality plan options, and unmatched network access. There are many benefit enhancements within our plans that are guaranteed if you have coverage with Delta Dental. Now I'm going to touch on a few of these right now, starting with not denying coverage due to pre-existing conditions. So for example, if you receive treatment such as a crown under another carrier, we would not deny any sort of coverage on that crown once you enrolled with Delta Dental. And I did see there was a question about veneers in the chat, and so I did respond to that question there as well. Applies to the same situation here. There are also no waiting periods on any services for you, your dependents, or your spouse. And this applies to all classes of service, including orthodontics, and it still remains true even if you did not sign up when you were first eligible. Replacement for a missing tooth, even if it was lost prior to enrolling with Delta Dental. And then also benefits for orthodontic treatment, even if it was started prior to coverage with Delta Dental as well. So if you had started treatment for braces with another carrier, we will begin your payment right where it left off. Next slide, please. We also have the largest networks not only in Oklahoma, but nationwide. With great network access spreading across the country, we want to ensure you're able to find a dentist with ease. We have two main dental networks, PPO and Premier. About 64% or around 1,100 participate in our PPO network. So knowing which network your dentist is in is extremely important when it comes to out-of-pocket costs at the dentist's office. The PPO network is where you will realize the greatest savings at the dentist. Next slide. We have two plan options again this year with no benefit changes for either one. And some highlights for the first one, the PPO plan, are going to be preventive services covered at 100%, Basic services such as fillings and oral surgery, those are covered at 85%. Major services like dentures and implants are covered at 60%. And then orthodontia is covered at 60% as well for all employees and dependents, with a separate $2,000 lifetime maximum per person. Next. As I mentioned before, you have access to both PPO and Premier dentists with Delta Dental. However, we would always encourage you to utilize a PPO dentist for the greatest savings. Seeing a Premier dentist will still give you discounts on services compared to a completely out-of-network dentist, but you will have to pay a bit more at the dentist's office than you would with a PPO provider. Next. The second option available again is the Delta Dental PPO Choice Plan. This is a low-cost program that is based on a pre-established fee table, which outlines the co-payment for each covered service. You're responsible for the co-payment amount and any deductible that may apply. Again, for this plan as well, we strongly encourage going to a dentist in the PPO network in order to limit your expense at the dentist's office. Next. If you are not sure which network your dentist is in, there are multiple ways to find out. You can always ask your dentist. You can download our mobile app and search for our dentist there. You can visit our website, use our online dentist search, or you can always contact Delta Dental if you are needing assistance. Additionally, please visit your custom website for state employees. Here you can review plan information, search for a dentist, get oral health tips, as well as register for our online benefits portal, Spotlight. Within Spotlight, you can see your own ID card and plan information, pull an explanation of benefits, review claims history, and much more. The custom website also does contain the fee table with all the co-payment amounts for the PPO Choice Plan. That website URL is listed on the screen, but just in case people can't see it, that website is deltadentalok.org/client/OK. Next. And then lastly, please contact our live answer customer service line at any time with any questions or concerns about your plan or just your experience with Delta Dental in general. Our customer service team has over 100 years combined experience at Delta Dental, so they are very tenured and educated on our plans, and they are ready to assist you with whatever you may need. That customer service number is 405-607-2100, and I'll drop the customer service number and the state website in the chat as well. If anyone else does have questions for me, please feel free to post them in there, and I appreciate the opportunity to be here. Thank you all very much.
Thank you, Eric. Okay, I'm going to talk about our Health Choice Dental Plan at this point. Again, we've had no benefit changes to this plan or premium changes for 2021. With the Health Choice Dental Plan, again, you can choose any dental provider that you wish to see. We pay both in-network and out-of-network benefits. But know, as everyone else has said, that you will receive the higher level of benefit, which means less out of your pocket if you use a dentist that is within the network. The Health Choice Dental Plan, just at a quick glance, if you are using a network provider, you can have your preventive services done, and those will be covered at 100%. And that's going to include your routine cleanings, your x-rays, your oral exams, etc. If, while you're there for that visit, they find that you do need to come back for additional services, there is a $25 calendar year deductible. Once that deductible has been paid for those basic services, which are going to be your fillings, your extractions, root canals, that is going to be covered at 85% by Health Choice. You pay the remaining 15%. For major care, which are going to be like your implants and your dentures, the more expensive type of work, Health Choice covers that at 60%. You pay the remaining 40% with a $2,500 calendar year maximum benefit. Health Choice does have an orthodontia benefit as well for children under the age of 19. There is a 12-month waiting period for this benefit, which means that the dependent would have to be on a Health Choice dental plan for 12 consecutive months before beginning treatment. Choice will cover orthodontic benefits at 50% of our allowable rate, but there is no lifetime maximum benefit for orthodontia, which means if you have a child that needs braces, maybe they were very young when they got their braces the first time, and something happens after they get those off, their teeth don't necessarily stay as straight as you would like them to. If they're still under the age of 19, then we will pay for a second round of braces as well. So that's one thing that is very unique to Health Choice plans. Orthodontics is only covered for adults if you've been diagnosed with TMD or TMJ, and that would require pre-certification before that treatment would begin. So the Health Choice Dental Plan, like I said, it's very easy to use. We've had no changes to that plan, and if you have any questions, please let myself or Leslie know in the chat, and we would be glad to answer those for you. If you do need additional services, and this just kind of goes over the different categories that fall under those basic and preventive restorative services. We do have a Health Choice Dental Handbook that is available on the website as well at healthchoiceok.com. Thank you very much. So at this point, MetLife, we do not have a representative with us today, but they do offer 2 dental plans for state employees. They have a high option and a low option. I would encourage you to take a peek at their plans in that benefit option guide. If you are interested in their plan and want to take a peek at their provider network, when you go to their website, look under the network that says PDP Plus, and that would be the appropriate network for State of Oklahoma members. So up next we have Miss Janet with Sun Life Dental.
Everybody, this is Janet with Sun Life Dental, and I'm going to talk to you a little bit about our dental plan. First thing to know is we really have no changes since last year on our plan design. Look at the next slide, please. This next slide is going to show you where our plan design currently is, in-network and out-of-network. Plan is always going to be a little bit richer if you stay within the network. There's a $25 deductible, but if you stay within network for preventative care, that is waived. It would apply to type 2 and 3. Also, you can see we have an annual maximum of $2,000 per person. And our orthodontic benefit is available for children under the age of 19 with a $2,000 lifetime benefit. There is a 12-month waiting period for that orthodontic benefit. If you transfer from any other state dental plan, we're going to give you credit for that, and we would waive that waiting period for you. So let me take a minute here and talk about out-of-network. We all have very large networks, but sometimes maybe your doctor's not in anybody's network. Sun Life reimburses the doctors very well if they're out-of-network. We reimburse at the 90th percentile, which means 9 out of 10 doctors in that zip code area are going to be charging what Sun Life allows, or they're going to be charging less. And the advantage for you, since Sun Life pays at that high allowable amount, is less opportunity that you're going to be balance billed the difference between what the plan allows and what the doctor is charging. Okay, next slide, please. So as I said, we have a large network in Oklahoma. You can save money if you're using the network doctor. We actually have a nationwide network, so if you have dependents in another state, maybe going to college, this might be a good option for you because there's a good chance they'll find a network doctor wherever they are. So if you look at our next slide, it's going to show us how we can find a dentist on the network. You can do our website, customer service number. If you think your doctor might be interested, you can nominate them to be on there. Another easy way is if you have our phone app downloaded, you can do a search through the phone application to find a dentist that way also. One tip that's really important when you're looking for a dentist, or you just call your dentist to see what plan they're on, just don't ask them if they take a particular insurance. You want to make sure you want to ask them if they're in network with that plan. Because there's a difference. They'll take any insurance, but that doesn't mean they're in network. So you want to make sure you're wording that correctly so you're getting the best information that you can get. Okay, next slide. Paper questions. One other thing I want to mention that's going to be new this year is, and Laura's going to be talking about this banner. She's going to show you a little later, but there's a link to each of the vendors on there. And Sun Life has a landing page that you can find a flyer about how to download that phone app. There's also a way you can set up an account for yourself so you can look at your claims. And the third thing that's real, I think, important on there is a nice way for you to find our provider link. It's a quick way for you to get to the provider area to look for a provider. I think that's all I have. Thank you for taking the time to speak with us today, or let us speak at you.
Thanks, Janet. Okay, and again, if anyone has any questions for any of the plans, please do not hesitate to put those in that chat function, and we will be glad to answer those for you. To wind up our presentations today, we're going to hear from our dental plans. And just kind of another reminder, all of the vision plans that are available to you include coverage for exams, lenses, frames, contact lenses, etc. They all provide coverage for network providers, and they all have their own network of providers. So if you have an eye doctor that you love and you want to stay with, make sure that one of the plans is accepted by their office before you enroll. And with that, we are going to turn it over to Wendy. She's with Primary Vision Care Services, and she will be our first vision presenter.
Thank you, Lori. Good afternoon, everyone. I'm Wendy Crosby with Primary Vision Care Services. We're very excited to kick off our 19th option period. And if you weren't aware, PVCS has been Oklahoma owned and operated since our beginning in 1994. And I'm very happy to announce that we do have providers in Stillwater. The Drummond Eye Clinic, Dr. Reeves and Dr. Snowden are in our provider network. So we're very excited about that. But our focus has always been on our members and their eye care needs. Next slide, please. So our in-network benefits include routine comprehensive eye exams covered at 100% with a $0 copay. And eye exams are not limited to once a year. So if you feel your vision is changing with PVCS, you can have another eye exam in the same plan year. It will be paid by the plan. PVCS members also pay wholesale costs for all prescription eyewear. So this includes your lenses and any lens options to include progressive lenses, polycarbonate lenses, anti-reflective coatings, transition lenses are provided at wholesale cost. The frames are also provided at wholesale cost. Now, PVCS members are eligible for glasses and contact lenses in the same plan year. Your contact lenses are also provided at the wholesale cost. This is all at wholesale rather than retail. It is a year-round benefit. PVCS members do have a $50 copay for their contact lens fitting. That is a one-time charge for a new patient or a first-time contact lens wearer. Next slide, please. The PVCS has over 350 independent optometrists and ophthalmologists in our network statewide, and all providers dispense glasses and contact lenses in their office. Now, we allow them, they can use the lab of their choice, including their own lab, to make your lenses, and that can result in pretty quick delivery of your eyeglasses as well. And should you elect the PVCS plan, you will not be issued an ID card. They're not required to use the benefit. You simply select a provider that's in our network, let them know that you're a PVCS member, provide your name, date of birth, and ID number, and the doctor's office will do the rest. Next slide, please. Members interested in laser vision correction can save up to $1,000 on LASIK at Enjoy in Oklahoma City. And we do offer an out-of-network benefit in lieu of the in-network benefits that we have. You can go to the provider of your choice. You will pay that provider up front their usual and customary fee, and simply send PVCS a paid itemized receipt for reimbursement. But the maximum you get back out of network is up to $40 on an eye exam and up to $60 towards glasses or contacts, depending on what you purchase. But we do recommend in-network to maximize your benefits and savings. But should you have any questions about the PVCS plan, you can chat today, you can call our toll-free number, you can email us. We do have a dedicated website for state employees. You can go to pdcs-usa.com. You'll click on the Oklahoma icon on our homepage, and you can view this presentation. You can request a plan summary, and you can view a plan summary. But we're very excited and happy. We look forward to serving you in 2021. Thank you so much. Back to you, Lori.
Thank you, Wendy. I've got too many screens here with too many buttons to push. So, up next we have Susie Brown. She is with Vision Care Direct.
Well, good afternoon, everybody. My name is Susie Brown. I'm with Vision Care Direct. And Vision Care Direct is a plan that is simple, flexible, affordable, and offers you some of the best value for your money. Next. Let's take a look at some of our improvements for 2021. Now, right now it says we have over 465, but as of 2 days ago, we've gained 20 more, so we're actually up close to 485 providers here in the state of Oklahoma, with thousands nationwide. That does not include our retail locations. We're excited to announce that come January 1, Walmart will be coming on with us. We also already have iDoc, iMart Express, Pearl Vision, and several more. We do have some additional LASIK discount providers this year that we'll talk about. We don't have any premium increases, but most importantly, we hope you overcome those dreaded out-of-pocket costs at the doctor's office. So let's take a look. Next. So, Vision Care Direct is patient-focused, which means we're focused on you. Now, whether you wear glasses, whether you wear contacts, whether you're one of those lucky people that don't do either one, I really strongly urge you to go and get a doctor's exam every single year. Get your eyes checked. The reason why is because your eye doctor can see diseases long before they become serious. Things like diabetes, high blood pressure, cholesterol, and even unusual things such as rheumatoid arthritis and even Lyme's disease. So you can go to an MD or you can go to an OD. It doesn't matter as long as you go and get your eyes examined each year. With us, that's a $15 copay to get that comprehensive eye exam. Now, we also give you $130 to go towards your glasses and or your contacts. And, you know, yesterday I got asked a question that said, well, what if I have to go to the doctor twice a year? What happens then? Well, normally, if you're going to see your doctor more than twice a year, it's due to a medical reason. Then, of course, by federal law, that has to be applied to your health coverage, and you would pay your specialty copay. Well, we at Vision Care Direct feel you shouldn't lose the value of your exam just because you had to go for a medical reason. So we have what we call Flex Exam, which gives you $55 to use towards those copays or anything at the doctor's office. Of course, this is in lieu of a regular eye exam. We also have what we call out-of-network or open access, either way you want to call it. That means you can go to any provider, anywhere, at any time, and have the majority of what you paid reimbursed to you just by filling out a simple form on the webpage and attaching your receipt. For those of you that like sunglasses, well, we don't have a prescription minimum. So if you don't need glasses this year, or maybe you're one of those people that's covering vision for your spouse or a child who needs them, but you don't need them, well, that means you still have a benefit. You can go to your doctor's office and use your benefit to get a nice pair of sunglasses. There in Stillwater, we have at least 3 Plus Plan offices, a standard office, and an iMart Express, so you have lots of providers to choose from. Next. We help you supercharge your vision plan. How do we do that? Well, we flip the model upside down. Most vision plans focus on low premium costs instead of focusing on what you pay at the doctor's office. And we understand you're not getting your pre-tax savings at the doctor's office. So what we've done is we've taken the most requested items at your eye doctor's office and bundled them into our premiums. This means you get free upgrades that can save you $200, $300, and even $400, even with discounts. Upgrades brands such as anti-glare, anti-scratch, high-definition lenses, oil and water repellent. You get no-line progressives, and you get polycarbonate. I was asked yesterday what's the difference between a standard lens and a high-definition lens. Well, that's the difference between your 1980s TV and that new QLED you have sitting in your house. The clarity is much, much more. So remember, with us, it's only $15 to get all those upgrades. And for those of us that have glasses, we know that the most expensive thing about a pair of glasses are the lenses. So if you do the math, what you'll find is that because you get the pre-tax savings and you're paying so much less at the doctor's office, you keep more money in your pocket. Next. Now, we're excited to announce that we have brought on a lot more of our LASIK discount providers. Last year, several people came to us during open enrollment and they said, we want more choices. So this year we have Dean McGee, we have ClearSight, we have Eye Care Associates of South Tulsa, we have OMEG, we have Triad, and we have Enjoy. You can go to any of those providers. You can get up to $1,000 off. All you have to do is mention that you're a Vision Care Direct member. Now, if you're going to do that, we strongly urge you to use your flexible savings account or your health savings account to save yourself some money. For more information or to download any of the flyers, you can go to our website. Next. Vision Care Direct is locally owned by optometrists right here in Oklahoma and is designed to give you the absolute best value for your money. Well, why is that important, being locally owned? Well, for one, you get local customer service. If you have a problem, we're here to help you right here. We are located right here in Oklahoma. Also, all the tax revenues stay here to support the schools, the career tech, the teachers. We support our teachers by offering scholarships each year for them, educational scholarships. Our doctors control your costs, and because they control your costs, they're focused on their patients, not profits. That's why it's so important to be locally owned. Next. Now, if you have any questions, you can call us at our customer support. You can go to the dedicated website, and at the dedicated website, you can sign in as a member, you can order a card, you can get information, you can find a provider. Also, for those of you that may like to chat, we can chat with you there. If you want a one-on-one to talk a little bit more, you can go to the website as well and set up an appointment to talk with me for anywhere from 10 to 15 minutes. I'll be glad to help you. Or you can email us at our oklahoma@visioncaredirect.com. And I used to say if you send me smoke signals, I'd answer. Well, this year I think we'll have to stick with email and the phone number. So does anybody have any questions? Anybody?
Susie, we do have a question in the chat when you have a moment.
Oh, okay, let me grab the chat real quick. Let's see here. So, Susie, can you get glasses and contacts within the same year? Our benefits allow you to pay for one or the other. But here's what normally happens. Let's say you go in to get your glasses. When you get your glasses at your doctor's office and you want contacts, they're going to give you a discount on your contacts as well. Or vice versa. If you choose to have contacts and then you want to get a backup pair of glasses, well, they're going to give you a discount on that as well. So it's one or the other, but you do get a discount on the second one. Any other questions?
Not at this time. Thank you, Susie, so much.
Thank you. Appreciate it.
Thank you. Next, we are going to hear from Stephanie with VSP.
Hi, how's everybody doing today? My name is Stephanie. I'm with VSP, and I want to thank you all for taking the time to learn about the VSP vision benefits available to you through the state of Oklahoma. Next. When you choose a VSP vision plan, you will receive great savings when you visit a VSP network doctor. So a well vision exam is covered in full every calendar year with a $10 copay. Prescription lenses and frames are available every calendar year with a $25 copay. Your plan includes a frame allowance of $170 every calendar year or a $220 allowance for featured frame brands. Your plan includes single vision, lined bifocal, line trifocal or standard progressive lenses for adults and children, as well as polycarbonate lenses for children. Your plan will also offer savings of 30%. The presentation only shows 20 to 25%, but this does offer the savings of 30% on lens enhancements such as scratch-resistant UV or anti-reflective coatings. Or you can choose contacts instead of glasses, and that has a $120 contact lens allowance with a copay of up to $60 for the contact lens exam. The Diabetic Eye Care Plus program includes services related to diabetic eye disease such as glaucoma and age-related macular degeneration. A $20 copay applies to these services. Limitations and coordination with your medical coverage may apply, so be sure to ask your VSP doctor for details. A yearly retinal screening that helps detect signs of eye disease is covered for a low $39 copay for all other members. Next. Members have access to additional savings when you visit a Premier Program location, including exclusive bonus offers, available only at Premier Program locations. A wide selection of featured frame brands backed by a 1-year worry-free warranty if your glasses are broken or damaged. Access to the latest in high-definition technology with Unity digital lenses are available, and advanced eye exam technology like retinal imaging. Next. Iconic is the only place where VSP members can shop online for contacts and eyewear with their VSP insurance in-network. So you can save time and money on quality eyewear with just a few easy clicks online. You connect your vision insurance, select your product, then you upload your prescription or provide your doctor's contact information, and we'll take care of the rest. Iconic offers a virtual try-on, free shipping, free returns, 100% satisfaction guaranteed, and we have a less than 5% return rate. Iconic has a variety of well-known name brands and contact lenses. Choose from over 35 eyewear brands and over 1,600 styles. Next. As a VSP member, you get access to exclusive member extras. We put our members first by providing exclusive special offers from leading industry brands totaling more than $3,000 in savings. Discover great deals on glasses, sunglasses, contact lenses, and more. We do a special deal on glasses, such as the extra $50 allowance on featured frame brands, up to 40% off lens enhancements, and you can save up to $50 on non-prescription sunglasses through Iconic. If you visit VSP.com, you can see additional savings on contacts and LASIK. Offers do vary based on your benefit plan. Next. VSP has one of the largest nationwide networks with over 38,000 providers and over 500 in the state of Oklahoma. There are 8,000 regional retail chain locations on the VSP network. Our retail chain providers currently include Walmart Vision Center, Costco, Pearl Vision, VisionWorks, and more. Next. And using your VSP benefit is easy. Once your plan is effective, you can create an account on VSP.com to review your benefit information and view the doctor network so that you can find an eye care provider who's right for you. Also, don't forget that you can maximize your savings when you visit a Premier Program location, and then at your appointment, simply tell the doctor's office you have VSP. There's no ID card necessary. Next. Choose VSP to get the complete coverage and quality you deserve at a price you want. To learn more, contact us at 800-877-7195 or visit the dedicated website stateofoklahoma.vspforme.com. And I'm going to send this out through the chat, but that ends my presentation. Let me go ahead and just send this link out for you. Oh, sorry guys, it's taken me a second for some reason to get this.
While Cynthia is sending that out, are there any questions for VSP?
We do have one question for VSP.
Okay.
Can you get prescription prescription glasses in lieu of glasses with VSP. Sunglasses, pardon me. Can you get prescription sunglasses in lieu of glasses with VSP?
You know what? That is a good question. So as far as sunglasses goes, it just says a 20% savings on additional glasses and sunglasses. And it says nothing here. I've never heard of anything being covered in lieu of. So I would say that's something that you could check out the website and see if the answer is there, or our customer service is incredible and they would be able to answer that. Sorry, you guys duped me on that question.
All right. Anything else, Leslie?
Not at this time. Thank you.
Thank you. Thank you to all of our plan reps that have joined us this afternoon. I appreciate you all taking the time out to attend the meeting. And if you would stay on the line just for a little bit longer to make sure that there are no additional chat questions for you. At this time, I'm just going to quickly go over the life insurance benefits that are available to you through Health Choice as a state employee. During option period, you can apply to increase the amount of your supplemental life insurance. The maximum amount that you can have through Health Choice is $520,000. That includes the $20,000 basic life that everyone has to enroll in as a state employee. You can also elect to add or increase or decrease even your dependent life coverage. For dependent life, there are 3 different options available. There's a premier option, a standard option, and a low option. And the one premium amount for whichever plan you pick covers everyone in your entire family. If you do wish to increase the amount of life insurance you currently have, you will need to complete a life insurance application during the month of October. And submit that application to our office by October 30th. On the front of this application, there's a section at the very top that Rebecca will need to complete as the benefits coordinator. In the middle of this form, it will ask you how much life you currently have in effect. So it'll say basic life in effect. So that will be your $20,000 amount. If you already have supplemental life in addition to your basic life, that amount will go on the second line. And the third line will be for any additional amount that you are requesting during option period. And then add all 3 lines up there at the end. Make sure that you sign and date the front of this application before completing the back portion. And now the back of that application, does contain your personal health information. So be sure to kind of keep that private for you since it does contain HIPAA information. But make sure that this entire application is completely filled out before submitting it to our office. Otherwise, it will be automatically denied. Also, if you're requesting $300,000 or above, we will ask for 2 years of medical records to go along with that. So you might as well start getting that ready as well. And again, the deadline to submit those applications is October the 30th. If you are making any changes to your life insurance, I would highly encourage you to update your beneficiary form as well. As employees, a lot of people will complete this beneficiary form when they are very first hired and then never think about it again. And depending on how long you've been with the state, lots of things can change. You may have gotten married, you may have gotten divorced, you had kids, your kids may have moved, whatever the situation may be. This form can be updated at any time throughout the year. And if you do update this beneficiary form, I would encourage you to keep a copy for yourself in your own personal records. You never know when something could happen, so you always want to make sure that this form is up to date so that your life insurance is paid to who you want it to be left to. The same goes for your Sooner Save or OPERS accounts as well. Now this is where I'm going to show you where to find all that fun information we've heard about this afternoon. On our Employees Group Insurance Division website, we have developed what we're calling an option period banner. And this option period banner contains everything option period. If you bear with me for just a moment, let me take you to a live picture of that site. Okay, can everyone see that website? Leslie, can you see that?
I can, Lori, yes.
Okay, thank you. So when you go to our website, you'll either see this picture of the option period banner where it says option period, or you're going to see a lovely sunset picture talking about retirement. If you click on this blue banner, it's going to take you to this page. And from this page, you can find premium information, a life insurance chart, which basically if you're wanting to add or increase your life insurance, but you're not real sure how much that's going to cost you each month, you can look at this form and it will add all of that up for you. We also have a great 10-minute video that kind of details what option period is, what kind of choices you can make during option period. But underneath that, you have these plan options. You'll look under this current employee tab, and we have all of the plans for your health, your dental, and your vision. And by clicking on one of those pages, or one of the plan logos, it's going to take you directly to that plan's state designated website. So you've heard everybody talk about in their presentation, we have a new state designated website. Well, this will take you directly there. So for instance, you have Delta Dentals right here. You can find a dentist, you can register for their Spotlight feature, and lots of other information. You have a customer service numbers, and you have a way to order materials from them, get your questions answered, and it's all right here at the click of a mouse. So we have that for each one of the plans. Some of them have plan presentations on their websites as well. So if you maybe didn't catch everything that someone said during their presentation, you can go back and review it here. Okay, and at this point, that brings us to the end of our presentation today. I do thank you all for attending. I know it's a lot more fun when we're standing there at the benefit fairs and we're able to talk to you face to face, and you're able to pick up a few goodies here and there. But I hope you got a little bit of information to help you make informed option period decision this year for yourself and your family. We do have a survey that I would like for you to take. It only takes a couple of minutes, but with everything being virtual this year in our option period world, our senior staff is very interested to know how the meetings are going, if there's anything that we can do to improve these meetings, if you found it useful, not useful at all, etc. So if you would take a minute to complete that evaluation, I would really appreciate it. Leslie's putting a link to that survey in the chat box, and then I'm also going to send it to Rebecca so that she can send it out as well. But again, I can't thank you enough for sitting here with us for the last hour and a half. And if you have any questions that maybe we didn't answer throughout the meeting, please let us know. You can put them in the chat feature if you would like. I'll keep that open for a few more minutes after the meeting, after I get done speaking here. But have a great option period, and don't forget to make any of your changes by October 30th. I'm going to turn it back to Rebecca.
All right. Sorry, it took me a minute to get back on. I appreciate everyone for attending. We thank all the vendors, insurance carriers for taking time out of their day to speak to us. If anyone has any further questions, if you let me know and I can see what we can do to get those answered. We were able to record this presentation today, so if there's parts that you'd miss, if you'd like to just see me and we can go over that. So thank you very much for attending.